my life. You are the pillar that holds my life. Master Jesus, you are the pillar that holds my life. Master Jesus, you are the pillar that holds my life. 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 Hello everyone, good afternoon from Nigeria. You are welcome to Noske TV. Thank you so much for your support. Thank you for being here with me. Thank you for celebrating my birthday with me. Thank you everyone from Heart Health, WhatsApp community. Thank you so much. The love is massive. Thank you so much. I appreciate you all. To people from Facebook, thank you so much. From people from LinkedIn, thank you so much. For people that have been watching this video in the nearest future, thank you so much for this day. Thank you for the month of March. Thank you, God, for helping us this far. Thank you for celebrating with me today. I'm so happy to have you all here. I want to say thank you for supporting us, KTV. We are now at 267 subscribers. Thank you so much for your support. Thank you for watching my channel. Thank you for liking my video, despite that they are not perfect. Thank you for listening to what I have to offer the world. I really appreciate you all. Thank you so much. Thank you for the birthday wishes. To all of my online fans, thank you so much. Online family, thank you so much. I appreciate. God bless you. Today, I'll be using today to actually educate us on how we can lower our risk for heart disease. How we can lower our risk for heart disease. As you all know, I'm proudly a heart health advocate, and I'm a nurse who is so passionate about heart health. um, I actually believe that with a good heart, we can actually, you know, learn more. Okay, and when we have more understanding, more knowledge about our heart, and take care of our heart, we surely take care of a lot of organs in our body. Thank you so much, Mr. Larewaju, for the congratulations message. I appreciate you. So thank you so much. Okay, so I will be talking about how we can lower our risk for heart disease. Sorry, give me some minutes. Uh, so we all know that our heart is a very beautiful and important organ in our body that helps us to circulate blood, okay, and gives all the organs, the vital organs, also nutrients. So, and the truth is that if anything happens to our heart, it's very easy, for other organs to suffer, okay. So that is why we need to take care of our heart. We need to protect our heart. We need to, guide it jealously. And according to World Heart Federation, we are made to know that more than 20 billion people die from cardiovascular disease yearly, globally. So, heart disease is known to be a lifestyle sickness, is known to be a disease that affects, almost 1 in 5, okay? So, not talk about people that are from a low income, country. Now, they don't even have more information. They don't even have what it takes for them to take care of their heart, or they don't even, they are not even aware of what is going on in their body. So that is why, as the heart health nurse, I just want to use the opportunity to now inform us about what we can do so that we can reduce the risk of heart disease among us, especially in Nigeria. So, number one thing I will mention is lifestyle. Heart disease has actually been associated to lifestyle disease. It's actually associated with lifestyle disease. Actually, some people are being born with heart disease. People that have congenital heart disease, they might have hole in their heart. A lot of people, babies, they are being born, and some grow like that. They are not even aware, that they have heart disease until some particular stage in their life that they got to know that they have heart disease. So, but for we that we are fine, our heart is doing good job, it's pacing, it's beating, our blood pressure is okay, our heartbeat is okay, we don't have any, cause of alarm over our heart. So how can we now prevent ourselves from this um, heart disease? Um, so, like I said, lifestyle is number one. We have to know what we can do. And when we talk about lifestyle, we're going to talk about our diet. We're going to talk about our activities, okay? We are going to talk about what we drink, what we are exposing ourselves to, our environment, okay? So, because the environmental damage that can actually affect our heart and our lungs. So from what we eat, we already know that salt, salt that people call, oh, okay, you can't hear me clearly? Okay, okay, okay. I'll make it more clear. Please just hold on. So if you can hear me clearly now, please let me know. So, like I said, salt is one of the things that we have to control, okay? And when it comes to heart disease, it's not age limited at all. It's not age limited. It can happen to any age in life. So we have to be very careful of the way we consume salt. We have to eat heart-friendly diet. Okay, we have to eat that. And when we talk about heart-friendly diet, we all know them, such as our fruits, vegetables, okay, and nuts. Okay, they are very good for our heart. Another thing is that we have to be very active. We have to be very active. We are the type that stay in a particular place for a long time. Okay, if you are the type that are using that stay in a particular place for a long time, you just have to start moving, okay, up and down. You just have to be active, dedicate at least. You have to, dedicate at least 30 minutes a day, for yourself to stay active, okay? So you have to stay happy, be moving, let your blood circulate very well. Let your blood circulate. Don't allow your blood to accumulate in a particular part of your body. So circulate your blood by what? By staying active. Okay, um, do not stay in a place for a long time. If you are the type that your job requires you to sit for a long time, please find time to break it. Know when to stand up, just move around, and also come back to your seat. Okay? Just move around, come back to your seat. If you are the type that stand a lot, try as much as possible to find time as well to sit. I hope you all understand. I think, is the voice clear now? Okay, so that's first about our lifestyle. We just have to adjust our lifestyle to reduce the risk of heart disease. Then the next thing I'm going to talk about is checkup. Yes, we are in this part of the world that we don't go for checkup voluntarily until something has happened. which is not a good thing to do. We should learn how to, walk into the hospital even if we are not sick, okay? Even if you know that you are healthy, you are okay, you don't have any issue, please still find some time to make sure that you visit your doctor, okay? Visit your doctor. Just dedicate maybe twice in a year for a general checkup. Check your blood pressure. Your blood pressure speak in a loud volume for you. Check your blood pressure. Make sure you know your numbers. A lot of people will go to hospital or maybe anywhere to check their blood pressure, and they will be told that their blood pressure is okay, is normal. They won't know the number. Please, it is very wrong. Make sure you know your numbers. Make sure you know your numbers. If your number is 150, 110, know it. If your number is 110, 120, know it. If your number is 110, 70, make sure you know your number. Make sure you know your numbers. Okay? Another thing is that we make sure that we can run some cardiac investigation such as ECG, okay? We can do ECG, we can do echo, we can do our blood test, okay, to make sure that we know what is actually going on in our heart. And if you actually run those tests and you were told you are okay, then you are good, you'll be comfortable, you have confidence about your health rather than assuming or just assume that you know that you are fine, okay? It is wrong. Let's, cultivate the habit of checking our doctors even when we are healthy. Even when you are healthy, let's make sure that we check on our doctor's door, let them run investigation, let them, run some tests for us to know how well we are doing, okay? So that's another way to prevent our risk for heart disease. The third one I've been mentioning is infection. Okay, infection. We should try as much as possible to avoid having continuous infection. Some people from mouth infection to sexual infection to all sorts of infection, and from maybe patronizing unrecognized hospital, doing some invasive procedure, any procedure that you do that is going straight into your blood, okay? You have to be very, very careful of it, because if infections enter into your blood system, it's very easy to touch your heart, and from there, you can start what we call heart disease. You can start, you can have heart infection. So make sure that you try as much as possible to prevent what we call infection, most especially mouth infection. So if you are the type that notice that your gum bleeds regularly, you constantly have a mouth sore, please check on your doctor's office. Check on them, let them know what is wrong, have a proper management of the infection so that it will not affect your heart. Okay? It will not affect your heart. Heart management is very, very expensive, okay? And we all know how the economy, it is right now. So we should try as much as possible to prevent infection by washing our hands regularly, okay? By paying attention to our body. If you notice anything you're not comfortable with, please quickly check with your doctor's attention and get it, to treat yourself effectively. The one that I will talk about that is actually close to that is self-medication. Some of us, when we are sick or we feel that we know that we are not really fine, we assume diagnosis. We just assume that we have typhoid. We assume that we have malaria. It might not be malaria. It might not be typhoid, please. It might be heart disease that is hiding, especially a woman. One thing about woman heart issues is that the heart, especially heart attack in woman, used to hide. It hides as if it's ulcer. They will have these funny complaints. They might even be thinking maybe it's menopausal issues, okay, until they run some investigations and they will get to know that it is heart disease. So please don't self-medicate. Make sure you see your doctor, and because some drugs can also cause harm to you. So getting medication on your own might be affecting you as well. So try as much as possible to avoid self-medication. Avoid self-medication. Avoid self-medication. Okay? So the next thing I'm going to talk about is mothers, pregnant women. Please, when you are pregnant, you have to take good care of yourself, and you have to taking the adequate diet and adequate medication that is necessary for the futures, okay? So that baby will not have congenital heart disease, okay? There will not be issue with your baby. Please take proper care of yourself. And a lot of women develop what we call hypertension in pregnancy, okay? So if you are the type that you don't start your what's it called, antenatal care quickly, you might not be able to detect hypertension in pregnancy early until it has reached a stage whereby the hypertension, it starts causing what we call eclampsia, okay? In a situation whereby a woman is having seizure, and the blood pressure is at the roof, okay, and they will say, oh, quickly, let's remove the baby, let's do CS, and the mother's life is at stake, okay? I've worked in ICU. I'm working in ICU presently, but I've worked in a medical ICU where we nurse series of women who have what we call eclampsia, okay, in intensive care unit. Some are not lucky, they died through the process. So if you are pregnant is a risk for heart disease. Yes, pregnancy is a risk for heart disease. So you have to make sure that you take good care of yourself during the pregnancy, eat early, and follow up with your antenatal care. Don't wait until when you are 5 months old, 7 months old. No, most especially preeclampsia normally show face at 20 weeks of pregnancy. But if you are the type that you don't even care, you might not know until it has caused a damage to you. So I hope you understand. Okay, the next one I'm going to talk about here is high blood pressure. High blood pressure, known as silent killer. Okay, known as silent killer. High blood pressure has caused so much damage, so especially here in Africa, and also in Nigeria. A lot of people believe that they would rather not know their blood pressure than knowing it. They believe that if I know my blood pressure, then hypertension has set in. Okay, which is very wrong. Which is very, very wrong. Make sure you check your blood pressure. It is very easy. We have made it digital. You don't even need to go to hospital to check your blood pressure. You just need to buy the machine at home. Get a small blood pressure machine called digital blood pressure machine. You wrap it in your hand, you press, and it will give you your details. It will give you your heart rate self. You'll be able to see your heart rate from it. You will see your blood pressure number, okay? So let's make sure that we have our blood pressure machine. Each family, so especially men at 40, let's make sure that we have this machine. We buy cars, we buy this, we have a lot of things, material things, but this machine is very cheap and it can save life. So make sure that you get one at home. So check your blood pressure at your convenient time, comfortably. Even it prevents what we call white coat hypertension. When some people is going to the hospital and they want to go and check their blood pressure, they are already scared. They are already scared because they don't even know what the numbers will be. So, and getting there, it is possible that the number will be slightly increased because of the tension that you are even going to the hospital. So if you have this blood pressure at home, it is very easy for you to check it on your own, know your numbers, okay? And if your number is very high, you don't need to say, I forbid it in Jesus' name. No. You don't need to say, I reject it. It's not about rejecting. When your blood pressure is very high, the next thing to do is to check again and again. So if the number still remains the same, that means Thank you so much, Nurse. Thank you, Mrs. Motolani. Thank you so much. I appreciate. Um, if the blood pressure is high, it is high. There is nothing like because I do this, because I was stressed. Okay, it's not because of that. So we need to make sure that we know the number. When the number is high, keep repeat, check it like 3 times. That is why they normally say high blood pressure is a persistent increase in our blood pressure. So if the number is persistent, then that means you have high blood pressure. And the next thing to do is to check your what's it called, your doctor's office. Run investigation to know the limit, the extent at which this high blood pressure has damaged any organ in the body. Okay, some hypertension disease has already caused heart failure, has caused a lot of damage. Okay, so when you know your high blood pressure, don't just sit down, don't just self-medicate, don't just assume, okay, someone tell me that it's the amlodipine that is the best, or someone says, oh, it is oh, okay. I will show you example of one. Okay, so I will show you example of one. So so that people can actually see the digital blood pressure machine that you can get at home. So if you check your blood pressure, don't just assume that, oh, it's amlodipine, it's like CO3. A lot of us know a lot of this antihypertensive medication, but please don't start the medication. Don't start the medication on your own. Make sure you consult your doctor or you see your health practitioner so that they can counsel you. They can make sure that. Oh, thank you so much for the birthday wishes. God bless you, ma. Thank you so much. Thank you so much. So this is an example of blood pressure digital machine. This is an example of it. Okay, and it comes with call. Okay, it's affordable. It is painless. It doesn't waste time. It doesn't waste time. Okay, you wrap it on your arm and you get your number. And a lot of it, they actually make sure that some can even communicate the values that you get for you. So when you have high blood pressure, please do not, I say and I repeat, do not start medication on your own. Because if you buy amlodipine, it might not be good for you. It might not be only high blood pressure that you have. You might even be nursing diabetes that you don't know. So, and some medication might not go with that for hypertension. But when you see your physician, your doctor, they will be able to, run some investigations and know the one that is best for you. Thank you so much for the birthday wishes. I appreciate. So you'll be able to know which antihypertensive that is good for me. Okay, another way to prevent heart disease is to avoid smoking and also avoid being a passive smoker. Okay, for example, you are not smoking, but you live with friends that smoke every day. That means you are inheriting it as well. All these things are toxin to your heart. Okay, it is not good. Okay, it causes heart disease. So let's make sure that we avoid that. If you are doing that, let's stop it. And let's make sure that we avoid unnecessary arguments, unnecessary pressure, unnecessary stress. Stress is bad. It's bad for your heart. It sets your heart on a high pace. Okay, your heart will be beating so fast. Your heart will be beating so fast. Stress is not good for our heart. So let's try as much as possible to avoid stress. Let's know when to relax. Okay, let's know when to relax very well. Let's know what relaxes us as well. It's not easy. We have so many stress, financial, emotional, work stress, a lot of things. But please and please, let's make sure that we delegate appropriately. We avoid that stress as much as we can. Because if you are down with heart disease is very expensive. That energy that you are throwing around and you are not able to use it. Our health is our superpower to achieve our goals, our dreams in life. Immediately you are sick or you are down, okay, then all those things that you thought you can do, they cannot do without you. That's all. Okay, so let's make sure that we try as much as possible to avoid stress. Relax. Yeah, problem no they finish. Like Nigeria used to say, problem no they finish. Oh, so make sure you do the one you can do. Find time to relax. And relaxing does not mean you are sleeping. You can just be at home, calm down, inhale and exhale, play with your children or your family. Just stay calm and relieve yourself from those stress. Okay, let's make sure we avoid stress, like I said, and let's try as much as possible to rehydrate ourselves. Our heart need water. Our heart need water. Let's try as much as possible to at least achieve 3 liters of water, at least 3 liters of water every day. Every day. It makes our kidney also happy. Okay, then if you have an underlying disease, a lot of people normally ask me, okay, do you think hypertension can be cured? And I would say in two ways. When hypertension comes, it might not be the primary disease. It might be something that brought out the hypertension. Okay, so if you have a diabetes, you are not taking care of your diabetes, you can have hypertension with it. If you have high cholesterol and you did not manage it, hypertension is already here, because the artery will be finding way to pump that blood out of those arteries, because all the arteries are already blocked with all those fat particles in the arteries. And that is why we need to know our cholesterol level. That should be part of the investigation that I want to do, to know our cholesterol level, to know what is to avoid high cholesterol, okay? And make sure that if you are placed on medication, please take your medication. If you're on antihypertensive, take your antihypertensive. Please do take antihypertensive. For people that have primary hypertension, that means that their hypertension does not really have cause. They just suddenly find that they have hypertension. Okay, their family has it, their father, their mother, their sister, their uncle has hypertension. Please, you have to be on medication, a good lifestyle to prevent heart disease. And heart disease, look at this heart disease I'm even talking about. We'll talk about heart failure here. We can talk about heart attack, cardiac arrest, and cardiac arrest is sudden loss, just the activities of the heart stop. And the person, if you didn't get help, the person dies from it. Okay, if you didn't get adequate help immediately. So you can have vascular disease, the arteries can be infected, the heart on its own can be infected, the doors of the heart that allow the blood to come in and shut, the valve, we call it doors of the heart, they can also be infected. It can be, they can have issues. And if the heart on its own is not getting blood, that's where attack comes in. Okay, you see people coming that they're having chest pain, blood is not circulating into their own heart. Heart that is pumping blood is not receiving adequate blood. Okay, so you see the heart, suffering, and the person will have serious chest pain. The person will complain of like heaviness in their chest. Okay, that is heart attack for you. But cardiac arrest, the activities of the heart can suddenly, stop. Okay, and when the activities stop, what happens? The person lost consciousness, and if the person does not get help immediately, then the person can die from it. So we have to make sure that we are educated. We know what's going on in our body. We embrace heart health information. We don't need to consume all the information on the internet. Just have a trusted source for your health information. Stay there, be educated, join a community of people such as health awareness. Okay, on WhatsApp, you can join us, and also subscribe to Noscape TV, where I share information about how we can prevent our heart, from having infection, diseases, and also other health issues. Okay, you can subscribe there for more information. Thank you so much for attending this show. Thank you for joining me. Thank you for your contributions. Thank you for the messages. I really appreciate. So let's make sure that we take care of our heart. We do as much as possible to prevent anything that can make our heart to be diseased. Please, let's make sure we do that. If you're having any disease such as diabetes, please, diabetes is not a joke. It's a systemic disease. It affects all parts of the body. Make sure you are taking your blood your blood sugar medication adequately. And if you're having hypertension, please don't assume anything. Don't start medication on your own. Make sure you see your physician or health practitioner to prescribe for you after taking your history to know which one is suit for you. Be careful of concussions. Be careful of all kinds of drugs and medication that are out there. Be careful of it. I've seen someone who bought a drink, and immediately he took that drink, the cardiac activity started firing. The heart was beating so fast that the heart could not stop. It was beating, it was beating. That means, and if your heart is beating continuously, that means the heart is not resting. It is not resting, and if care is not taken, the heart is shut down. The heart is shut down. So we thank God for that person because he was able to get off immediately, and that is how the heart was quiet after maybe 1 week in the hospital. So we should try as much as possible to prevent ourselves from consuming what we don't know. And even if you want to buy anything, you can easily check the brand, the salt level, the cholesterol level, the expiry date of all those things that you want to take. Okay, so make sure you rehydrate yourself. Like I said, avoid infection, be informed, embrace health education, okay, and from a right source, get health education from a right source. A lot of information are online, and if you are not very careful, you will just be picking and be taking the one that you're not supposed to consume. So please and please make sure that you embrace good information about your health and be a good CEO of your body. Learn and know when your body needs attention. The truth that our body communicates. Some is headache, some chest pain, some back pain, some any type of uncomfortability in our body. We know it, and we know when to speak out, when to seek for help. Don't let us hide it. Speak to people that can help you medically. Don't just assume that, oh, I will take malaria tablet, I will take typhoid tablet, and that will be all. It might not be all. So let's try as much as possible to do the needful in our own part and be a good CEO. Thank you for joining me today. Thank you for your contribution. Thank you for not leaving me here alone. I appreciate you all, and I wish to see you all next year. Thank you so much. God bless you.